All right, everybody. Mr. Griffin coming at you here from room 227, and today is going to be the fourth and final video in the anatomy video series covering the lecture material on the introductory unit. Today we're going to talk about medical imagery, x-rays, MRIs, that kind of thing. So without further ado, let's go ahead and get started. All right, so medical imagery. These are techniques and procedures used to create images of the human body. Some of you probably have some experience. If you have been injured or been to the hospital and they needed to see what was going on inside, you've probably had an x-ray and or possibly an MRI. Those are some of the two fairly common procedures that are done today. So medical imaging allows visualization of structures inside the body, and the advantage to that is we don't have to cut you open to examine. They can go ahead and take a look without the need of exploratory surgery. The diagnosis of anatomical and physiological disorders, so they can do a chest x-ray, and today with the COVID-19, a lot of times those individuals will have a lot of fluid buildup and the beginning stages of fibrous tissue forming in the lungs, and that will show up on an x-ray. And then of course the conventional radiography or x-rays that has been around since the 1940s. So that one has been in use for quite some time. And an MRI, magnetic resonance imagery. So the difference between an x-ray and an MRI is that an x-ray doesn't show soft tissue very well. It's good at showing dense material. So if you've ever seen an x-ray, they use them a lot for skeletal injuries because the bone is dense and shows up very well on the x-ray. The tissue around it, though, doesn't show up very well. So if they think you have soft tissue damage, say torn cartilage in the knee, then they can do an MRI, and the MRI will show the damage to the soft tissue. Now, it does take some practice to learn how to read an MRI and know what you're seeing, but it will enable the doctor to determine the kind of soft tissue damage that you have and the extent of soft tissue damage. And of course, you can't, if you have metal in your body, you can't, it's not recommended that you do an MRI because the magnets in the magnetic resonance imaging machine are very powerful. And if you have metal that is iron containing or ferrous and will be attracted by the magnet, it will be ripped from your body. And I can only imagine that that would be painful. So how the MRI works is protons in your body fluid align with the magnetic field used for differentiating normal and abnormal tissues such as tumors, brain abnormalities, blood flow. And again, if you have damaged cartilage or ligaments or tendons, they can see that as well. So the magnets bombard all the protons that are in the fluid, and then when the magnetic wave goes through the body, the fluid will disrupt those waves, and that's what then the machine reads the disruption in the waves, and that's how you get the imaging. It can provide two-dimensional and three-dimensional color images. Three-dimensional is relatively new in MRI technology, and these images can be viewed on a video monitor. If you've ever had an MRI, a lot of times that you look at it, you don't really know what you're looking at, and that's because you have to have training and understand what the colors and the variation in the picture, how those are represented by the tissue in your body. A CT scan, computer tomography or CT scan, done using a computer to organize x-rays to form a 3D image. So they take a series of x-rays and then put them all together to form the image. It is used to visualize soft tissue in more detail than conventional radiography. So here we have a picture of a CT scan, but notice the lungs are not in this picture for whatever reason. So clearly they should be right here, but we're looking at the heart, which is soft tissue, but the lungs are not visible, and a lot of the blood vessels are not visible. The large blood vessels off the heart are not visible in this scan. Tissue intensity show varying degrees of gray. So the very dense tissue, the bone, you can see here is white. Here's the shoulder blade or scapula. Here is a vertebrae. It's a thoracic vertebrae there in the chest. Here we have a few ribs, and their sternum is right there. So the skeletal structure puts off a much brighter color because it is more dense. And here we see the muscle tissue is a nice soft blue because it is definitely soft tissue. And the heart, which is also muscle, gives off the same color. Whole body CT scans expose the body to high dose of x-rays, which they, if you've ever had an x-ray, they will give you that lead apron. The lead blocks the x-rays, and they especially will want to cover your organs of reproduction. They have found out that x-rays can mutate your gametes. So either sperm or egg cells can be mutated by x-rays, which means if those are the ones that will be used, that could possibly lead to birth defects. Here are 3 cross-section images of a head from the Visible Human Project. They are done using the 3 modalities discussed above. So from top to bottom, photography of frozen sawed head. So this is an actual cadaver. This is a picture taken of a human head cut in half. So that is a real photograph. This is the CT scan showing, again, the bone is nice and thick and white. You can see there the cranial cavity, the spongy bone there at right around in the cheek area, and then you can see the jaw and the nasal bone. And then the bottom one is your MRI. And again, the MRI is the magnetic resonating, and you can see it shows the brain, that soft tissue. There you can see the liquid in the eyeball. Here, it would be the eyeball, and it doesn't show up because that liquid doesn't reflect the x-rays very well. MRI, though, reflects liquid very well, so we can tell that the eyeball there is full of fluid. Ultrasound scanning, this is something new that they're able to show 3D images now in ultrasound. This is done with high-frequency sound waves. It is non-invasive and painless. They'll squirt a little bit of gel on you, and they'll emit the high-pitched sound waves, the high-frequency sound waves into your body, and the tissue inside the body will cause those sound waves to bounce back depending on how dense they are and the shape that they are in. So it's kind of like sonar, but for your body. Because of its safety profile, it is commonly used to monitor the progress of fetal development during pregnancy. And this is a very common thing. My wife had a couple, when she was pregnant with our son, she had a couple sonograms just to make sure that everything was developing along nice, normal parameters. And it's interesting. I tell this story a lot in the reproductive unit. But they did the sonogram when my wife, I think, was at 16 weeks pregnant, and they measured just to check and get an estimate on due date, and they measured his femur, and they measured the length of his skull from front to back. And I remember thinking, oh my gosh, that is really small. So his femur was 3 millimeters long, and his skull from front to back was 9 millimeters. So his skull was the size, if you've ever seen a 9 millimeter bullet, that was the size of his skull from front to back. And I always thought that was amazing that he was in a fetal stage a tiny little human being, but his head was the same size as a 9mm bullet. And I found that to be pretty amazing. Another form of medical imaging is endoscopy. This is basically a tiny TV camera in your body. This is done using a lighted instrument with a lens projecting an image on a monitor. Colonoscopies are done this way. They will actually insert the camera into the patient's colon and examine the colon to look for polyps, to try to cut off colon cancer before it becomes too bad. A laparoscopy is a study of the organs in the abdominopelvic cavity, where they can go in and check other organs inside the abdomen. Arthroscopy is a study of the interior of a knee joint, especially in the knee. So if you've ever had arthroscopic surgery, that is how they do that. They make, on mine, they made 2 small incisions. One was for the camera, and the other incision was for the tools. And I had a simple procedure. It was a meniscectomy, which is a removal of a section of my meniscus. And they had the camera so he could see what he was doing. And in the other incision, the tools went in and trimmed away my torn piece of meniscus. And in the old days, before endoscope was used in surgery, they would have to cut my knee wide open and gone in there and cut that little piece of meniscus out, and then there would have been a much longer recovery due to the larger surgery scar. Now they make 2, sometimes 3 very small incisions, and the recovery is much faster. And that is the end of the lecture material for the introductory unit. All right, as I said, that's the end. That's the last one for this unit. So go ahead and log out to get out of YouTube and head on over to Schoology and find out what form your exit slip will be in, whether it's Edpuzzle or Nearpod or just a simple exit slip on Schoology. So that has yet to be determined, but it will be there. So go ahead and look for that and have a good day. And as always, thanks for watching.